Hello guys, how are you all? Good evening Namnath, Chavan, Pilot Saini, good evening. Aaron, good afternoon. Aaron, Siddharth, good evening. Suraj Kumar, good evening. No, Sanyasi, today also I'll be taking a little bit more. The types of synovial is left over. Riya Singh, good evening. Najmul, good evening. Cheguri Princy, good evening. How are you all? How are you all doing? Right. So yesterday we were discussing. Yesterday with good evening Athar, Jagdish, good evening. So yesterday we were discussing regarding the joints, and you have practiced well about the MRI scans also, right? About the clergyman's knee, right? About the prepatellar bursitis, which is also called as what? Which is also called as housemaid's knee. So these are the things which you have practiced yesterday, right? So we were actually discussing about the synovial joints, the last part, right? So we discussed a typical synovial joint. We discussed all the abnormal conditions which can happen to the synovial joint, right? Whatever you needed to know. And now we shall be discussing what are the different types of synovial joints. Okay, basically this is one of very important thing. Ketawat, class from Vietnam, very good, very good, very good. Right. So let us start discussing, right? Let us start discussing what are the different types of synovial joints, and after that we shall go back to our topic of gametogenesis. Okay, in that we shall mainly discuss the mechanism of how spermatogenesis occur and how oogenesis occur. Okay, but out of both, oogenesis is very important. I think you guys know what is mitosis, what is meiosis, oogonia, oocyte. So these things you're already brushed up a lot of times in your MBBS, sorry, in your plus one and plus two, right? So those things again it will brush up for you. So chalo, let's start now. Right. So we shall discuss about the types of synovial joints. All of you stop commenting now. Just pay attention to whatever I'm telling. Types of synovial joints. Now when it comes to types of synovial joints, how do you remember all these synovial joints? The best way to remember all these synovial joints is, for example, let us say you're traveling in a car. Okay, now on the back seat there you have got a very big bag there. Okay, suspicious bag, let us say very big bag, black color bag. Now police who is coming behind in the car, obviously he'll look at that and get doubt, and immediately what he'll do, he'll pull your car aside to check that, right? So whatever just now I have told you is actually the mnemonic. Okay, so how do you frame this mnemonic is that, so all of you look here. Police, right? He had pulled your car. Police had pulled your car. Why? Sadly, because he found a bag, right? Sadly, because he found a bag. Right now guys, you are the ones who are going to tell me what is P. What is P standing for? Yes, what is P standing for? This is not paid, Sheikh Umar. This is a free lecture, you can watch it right now, right, as you are watching already. What is P standing for, guys? P standing for what kind of synovial joint? Very good, very good, Aaron. Fun mode, very good, very good. Tamil speaker, very good. Pivot is also, I'll tell you about the pivot in a short while. But P stands for planar joints. Very good. This is called as planar joints. Okay, and H stands for what? Excellent, very good. H stands for hinge joint. H stands for hinge joint. Okay, now pulled here comes for pivot joint. Pivot joint. Ricky, it is your wish if you wanted to buy an iPad, right? Actually, this is a class, we cannot discuss those things. You want to buy iPad, you buy. If you want to buy a Samsung tab, you buy. You want to buy any other tab, you buy. Okay, whatever you want, you can buy. Right. So next important thing, C. C stands for condylar joint. Okay, C stands for condylar joint. And in the same way, we have got S and B. What is S standing for? S stands for saddle joint. Okay, saddle joint. And finally BA. What does BA stand for? Very good, guys. BA stands for ball and socket joint. Okay, BA stands for ball and socket joint. So these are some of the joints which you have to know. Now what we shall do is that we shall discuss each and every joint, the mechanism of the joint. Okay, you might have studied uniaxial, biaxial, multi-axial in your +1 and +2, right? You also know it is called as hinge joint, है ना? Hinge मतलब door का जो hinge होता है, that hinge, right? So many things you have studied. We shall clarify one of them along with the examples, okay? And I'll make sure that I'll draw pictures for each and everything. Now, the first three joints जो भी है ना, these are called as uniaxial joints. What are these joints called? Uniaxial joints. Okay. After that, the next two joints, whatever are there, these are called as biaxial joints. These are called as biaxial joints. Uniaxial, biaxial, is there anything called triaxial? No, right? And सीधा क्या है? Multi-axial is there. So this is a multi-axial joint. So we have got three uniaxials, two biaxials, and one multi-axial. Okay. So we shall look one by one. You're Tom Cruise. Very good. You're understanding it, and very good. You're answering it perfectly. So coming to the uniaxial joint, first part. What is the first joint over here? The first joint over here is planar joint. Okay. So let us see what is this planar joint. Planar joint. Now, what do you mean by planar joint, guys? Planar joint matlab, see, all of you just watched whatever I'm telling you. What is planar joint? For example, all of you know that here we have got 8 carpal bones. Yes or no? We have got 8 carpal bones here, right? So let us say these 4 are the carpal bones. Okay, these 4 are another carpal bones. So one set of carpal bones are sitting on another set of carpal bones like this, right? Now, the joint that is formed in between the carpal bones is called intercarpal joint. Okay, what is this joint called? Intercarpal joint. Now, these carpal bones, if you look from the side, these carpal bones can move little bit forward. It can move little bit backward. Okay, it can move little bit forward. It can move little bit backward. Can the carpal joints jump like this? Can it go like this? No. So either it can move little bit forward or little bit backward. Okay. Now, if they are sliding little bit forward and backward, can I call them as sliding joints? Right? So forward and backward in a single line, they are going front and coming back. So that is why can I call them as uniaxial joints? Right? And third important thing is this sliding or gliding is very minimal, not very exaggerated like this, right? Very minimal sliding. So can I call it as minimally gliding or minimally sliding joints? So there are quite different names that are given for this planar joints. What are the different names? For example, first important thing I can give is these are also called as gliding joints. Okay, or these are also called as minimally sliding joints or minimal sliding joints. So these are the different names that are given for this. Okay, so if you see here, this is one carpal bone, 2, 3, and 4. Here also 1, 2, 3, and 4. Right? So in between the carpal bones, this joint, whatever is there, is called as intercarpal joint. Okay? Tamil speaker, uniaxial. What do you mean by uniaxial? Okay, here I cannot explain you clearly. In the next example, I will tell you what is exactly uniaxial. Okay, uniaxial means moving in a same axis. I'll tell you in a minute. Okay, so if you didn't understand here. So these are what? These are carpal bones. Carpal bones are similar to tarsals in the leg, in the foot, right? So there also the tarsal bones, in between the tarsal bones, the joint is called intertarsal joint, right? So if there is intercarpal, why not there is intertarsal? There is also intertarsal. So here, right now I'm giving 2 examples. Later on I'll give much more examples. Okay? Right now just 2 examples you need to remember. One is intercarpal joints. Okay, and the second one is intertarsal joints. So intercarpal joints and intertarsal joints, both of them are what? Both of them are your planar joints. Okay, now after this planar joints discussion is done, the second one, what do we have? Hinge joint. Okay, so what is this hinge joint? What is this hinge joint, right? So all of you guys, can you look at the hinge here, right? Tamil speaker, now listen carefully about this hinge joint. So you can look at this hinge joint now, right? So all of you know that this is the hinge of the door, right? Doors have got hinges, right? And what is the use of this hinge? It is with the help of the hinge you can either close the door or you can either open the door, right? You can either close the door or open the door. Now can you lift the door up like you lift the door of a Lamborghini car? You cannot lift it. Can you twist the door like this? You cannot twist it. There is only one line. If I'm drawing a line like this, so the door is opening in that line and door is closing back in that line. So in a single line there are two actions that are happening, opening and closing. This type of joint is called as uniaxial because it is moving in a single axis. Now you understood what is uniaxial, right? So what is a single axis joint in our body? All of you look, this is the elbow joint. See, I can either flex my elbow. I told you flexion extension, if you remember. Flexion matlab decrease in angle. Extension is increase in angle. Okay. Either I can flex my elbow or extend my elbow. Now can I put my elbow all the way to the left or all the way to the left or right? No, I'll break my hand. Right? So my elbow gets broken. So I cannot do that. So either I can flex or I can extend. Only one action is there. So can I tell elbow joint is a hinge joint? Right. Second important thing, look at the knee joint also. Knee joint also, either you can extend or you can flex the knee. Right? If this is the knee, this is the patella, either you can extend the knee or you can flex the knee. Only one action. Right? Look at these joints. The joints that are located in between phalanges. All of you know that these are phalanges or digits which you have studied. So between each and every phalanx, see exactly here and here, these joints are called interphalangeal joint because it is present in between the phalanx, right? So let me show that to you. So all of you look at these joints over here, right? Actually, these are not phalanges, okay? So these are metacarpals, okay? These are not phalanges, but just look at this, okay? For example, this is one phalange. Just think this is one phalange. These are not phalanges, okay? This is one phalange. Just for an example, just think like that. This is another phalange. So one phalange is attached to another phalange, right? Now they can flex, they can extend. They can flex, they can extend. Can they move like this? No. Only one axis. You see, I am flexing my fingers, extending my fingers. Can I move my finger like this, twist it like this? I cannot twist it. So even interphalangeal joints are also what kind of joints? Hinge joints, because they are moving in a single axis. And what is the function? Flexion, extension. Flexion, extension. In the knee also, flexion, extension. Right? So let us write that thing down now. Right? So if you see over here, in hinge joint, you will see two things. One is called as flexion, another one is called as extension. Flexion and extension. Okay. So thug gamers, it is highly impossible to teach all the 4 volumes of anatomy in this, because I not only teach anatomy, I also teach remaining subjects. Okay, so it is highly impossible to teach all the 4 volumes over here. So for that complete anatomy, our app is going to release soon, right? So in that app you will have my complete section of videos on anatomy. Okay, so don't worry about that. I'll immediately post about the link of the app and everything like that. Okay, so see, if you are able to move your finger little bit laterally, it means you are a magician. Okay, normally we can't move our finger. How can you move this finger? This, not this movement, guys. This movement is happening between a phalange and a metacarpal. Okay, this joint is called as metacarpophalangeal joint. I'm not talking about this. I'm talking about this joint and this joint. These two joints over here are interphalangeal joints. You cannot move. I cannot break my finger. Okay, chalo. So the examples, the first example is elbow joint. First example, what is this? Elbow joint. The second example is knee joint. Knee joint. And the third important example is interphalangeal joint. Interphalangeal joints. Okay, so interphalangeal joints. I hope all of you understood. I hope all of you understood, right? Very good, very good. So after this hinge joint, the next important joint we shall be discussing is called as pivot joint. Okay, so what is this pivot joint? So this is your hinge joint. Okay, now let us discuss about pivot joint. I hope everyone is perfect about pivot joint, right? All of you might have studied about pivot joint, and I am sure that you also know the example also. Chalo, before knowing the example in this picture, whatever is there, I will tell you one more example. Okay, let us say this bone, whatever you are seeing here, this is your humerus bone. Okay, below the humerus, you have got two bones, humerus. One which is located on the lateral side is called radius. One which is located on the medial side is called as ulna. Okay, so let us say this is your radius. Okay, and let us also tell that this bone over is your ulna. Okay, so this is your radius bone, this is your ulna, and this is your humerus. If you remember in yesterday's class, I have already told you between the radius and ulna, I don't have the bones right now, I'm sorry, but between the radius and ulna, we have got three important types of joints. One is located on the top, one is located in the middle, one is located in the bottom. So top one is called superior radio-ulnar joint. बीच में जो है the name under middle radio-ulnar joint, and नीचे जो है that is called as inferior radio-ulnar joint. You remember that, right? And I also told you this thing that superior radio-ulnar joint, inferior radio-ulnar joint, both of them are movable joints. But middle radio-ulnar joint is not a movable joint. I told you this thing, if you remember it. Okay. So exactly to tell, this is how the joint is located. Let us say this is superior radio-ulnar joint. Let us say that this is inferior radio-ulnar joint. Okay. Now, for example, let us say I am ulna bone. Okay, I am ulna bone. There is radius standing in front of me. Now, what I am doing is that I am hugging the radius. Right? Now, when I am hugging the radius, this is ulna, that is radius. In between both of us, there is a gap. Right? In this gap, a third person can enter inside. Now, what are the actions can I do? Can he jump out of my left hand? Can he jump out of my right hand? No. Can he jump up and down? No. Only one action what he can do is he can rotate in between both of us. Right? The same thing is happening here, and that rotation is called as pivot joint. Okay. So the same thing which is happening here, I have shown you the video also. You see, ulna is still. This is radius. Radius is overlapping over ulna. Radius is overlapping over ulna. It is rotating over ulna, right? So this is because of two joints. First one is superior radio-ulnar joint. Superior is radio-ulnar joint. And the second example is inferior radio-ulnar joint. RUJ is radio-ulnar joint. Now the famous example, all of you know, third example, that we have got two bones in the neck. Okay, what are these two bones? One is called as atlas, one is called as axis. Let us say this is atlas. Okay, let us say this is axis. Now what is happening? The axis is fitting into this atlas, and finally it is rotating. That is how you are able to rotate your neck like this. Yes or no? So this is also called as a pivot joint. And this joint which you can see in this picture here is called as atlas axis joint. Combine both the words, atlantoaxial joint. Okay, so that is atlantoaxial joint. Atlantoaxial joint. Okay, so these are the three examples which you need to know. Okay, now after this we are done with what? Planar joints, hinge joints, pivot joints. Now we shall be discussing condylar joints. Now dekho, condylar joints are biaxial joints. Remember that thing. Okay, so now we shall discuss about condylar joints. Condylar joints. Okay. Now, condylar joints are also called as bicondylar joints. Why they are called as bicondylar joints, I'll tell you in a minute. They are also called as bicondylar joints. if a joint has to be formed, two bones have to be there, right? Let us say this is bone number 1. This is bone number 1. Let us say this is bone number 2. Bone number 2. What is the difference between bone number 1 and 2? Both of them are forming a joint. What is the difference? One bone is completely convex, another bone is completely concave. So can I tell like this? If someone is asking me what is bicondylar joint, I will tell that convexity of one bone is fitting into concavity of another bone. This is a definition, right? So both the ends are called as condyles. That is why I'm calling it as bicondylar joint, right? But both the ends are not similar. One end is convex, whereas another end is concave. Okay, even if you look at this joint over here also, what is this joint, guys? This joint is the knee joint. So look at the bone. So the femur, all of you know this is femur bone, and all of you know this is tibia bone. See, the femur bone is convex, and all of you know the tibia bone is concave. So can I tell this as a bicondylar joint? If you want, I'll show you an example over here, right? Right. All of you look at this. This bone over here is your femur bone, and this bone over here is your tibia bone. Okay. So what I'm doing right now is, if you see, the condyle of the tibia is concave or convex? It is convex. Look at the tibia. Tibia condyles are concave. The femur condyles are convex, tibia condyles are concave. So convexity of one bone is fitting into concavity of another bone. So what is happening because of this? There is this motion. Okay, this is called flexion, extension, flexion, extension. You're getting it, right? So I hope you understood what I was trying to mean. Okay. So first important example is knee joint. Okay, knee joint is a type of bicondylar joint. Now, after the knee joint, the second important, very important example, guys. What is this very important example? Now, if I'm talking, how am I able to talk? Because my mandible is moving up and down like this, right? So, all of you know that this is your temporal bone. I told you this is temporal bone. Now, just move your mandible like this. When I'm moving this mandible, I can feel there is some movement here, right? What is this movement? This is the exact place where my mandible is fitting into the temporal bone. So mandible attached to temporal bone. Join both the words. Temporomandibular joint. Okay? Temporomandibular joint. Clear? Now all of you look here. Let us say that this is your mandible. This is your mandible. Okay? Now all of you look here, guys. Mandible is concave or convex here? Mandible is concave, right? But don't think about this part. This is not the part which is fitting. This is the part which is fitting. See, look at this part. How is this? This is convex, right? And in the same way, I'm pretty sure that you can't see here, but here there is some depression like thing. This is a concavity. So what is happening here? What is happening is convexity of mandible is exactly fitting into concavity of your what? The temporal bone. So that is the reason why this action is formed. So either you can open the mouth or you can close the mouth. Open the mouth or close the mouth. Okay, you can even move side to side also. So this movement is called as bicondylar joint. So I hope you understood what is bicondylar joint in detail, right? Chalo. So this is what I was trying to tell you, that here this is a temporal bone. This is a temporal bone, okay? And let us say that here this is your mandible. This is your mandible. And you know you have got your beautiful teeth over here. Right. So you can see very clearly here, convexity of one bone is fitting into concavity of another bone. So this joint is called as temporomandibular joint. Temporomandibular joint. Okay. So second important example is temporomandibular joint. Guys, still here, all of you understood whatever I've taught you? Yes or no? Just give me a green signal. Very good, Lipika. Najmul, very good, very good. Chalo. Now let us not waste the time. Let us go to the next important joint. Okay. अभी ये next important joint क्या है? This is saddle joint, okay? But guys, before discussing saddle joint, I want to discuss one more joint which starts with C. Okay, one more joint. Okay, what is that? All of you look here. So one more joint which starts with C. I'm going to put a line over here. This becomes E, and this joint is called as ellipsoidal joint. This joint over here is called as ellipsoidal joint. Okay. Now look at the ellipsoidal joint very, very, very carefully, guys. Just look at this. This is one bone, right? And this is another bone. Now by looking at this, sir, this is not ellipsoidal. This is condylar joint. Yes, because one is concave, another one is convex. Now look at this bone now. Here also we have got a bone which is convex. Now look at this. Look at this. Look at the shape of this one, bone number one, and look at the shape of this, right? So this is patient number one, patient number two, right? So in the patient number two, you see a concavity. Actually, concavity is not a disease, okay? I'm just telling you there are two people. One is having convex, right? One is having concave, another one is having ellipsoid. So this kind of joint is called as ellipsoidal joint. Okay. If someone asks you the definition, what will you tell again? The same thing. Convexity of one bone is fitting into ellipsoidal cavity of another bone is called as ellipsoidal joint. Clear? What are the examples? These are a little bit tricky. With the picture only you will understand here. So all of you see, this bone is your radius bone, this bone is your ulna bone. I have drawn this part over here. Okay. Now here you have got what bones? Here you have got carpal bones. See, you have got 1, 2, 3, and 4, 5, 6, 7, and 8 carpal bones. Right. Now you tell me this thing. How is this surface here? This surface is concave or ellipsoid? It is ellipsoid. And look at the surface of carpal bones. The carpal bones are convex. Let me use a pink sketch. The carpal bones are convex. So can I tell this joint, the convexity is fitting into ellipsoidal cavity? Right? So this kind of joint, what is this joint by the way? Wrist joint, right? The wrist joint is an ellipsoidal joint. Agar wrist joint condylar joint hota, if wrist joint was condylar joint, you can move the wrist, you can flex the wrist and you can extend the wrist. You cannot do this action. Why are you able to do this action side to side? It is because the wrist joint is not convex like this. The wrist joint is ellipsoidal like this, which is allowing a broader movement in this way. I hope you understood now clearly, right? So the first example is your wrist joint. Wrist joint. Okay. Second important example, after the carpals, all of you know these are carpals. All of you know these are carpals. After the carpals, what do we have? Metacarpals, right? So here we have got metacarpals. You see these metacarpals over here? These are the metacarpals. How many we have? We have got 5, right? So these bones over here which you can see, these bones which you can see are your metacarpals. Now tell me, look at the surface of metacarpals and see, are they concave or they are ellipsoidal? They are ellipsoidal. So from this view you can see, I think, right? So from this view clearly you can see these metacarpals are ellipsoidal. You see, ellipsoidal. So if these metacarpals are ellipsoidal, what is happening? If I have to draw a joint between in both of these like this joint is carpo-metacarpal joint. Yes or no? So these are metacarpals. Joint between both of them is called carpo-metacarpal joints. Okay. So the second important example is carpo-metacarpal joints. Carpo-metacarpal joints. Clear? Guys, all of you understood? Very good, very good, very good. Now we shall go on to the next joint that is in the list, that is by name saddle joint. That is in the name saddle joint. Okay. So saddle joint is really very easy, guys. So if you look at the saddle joint, you'll understand. So this is one bone. Okay. And this is another bone. Okay. Now, if you look here very carefully, one bone is having a two convex surfaces and it is also having one concave surface. The next bone is also having two concave surfaces and it is having one convex surface. So, what can I tell about the definition of this? Convexity and concavity of one bone is fitting into convexity and concavity of another bone. That kind of joint you call it as saddle joint, right? So, how do you remember this saddle joint? Okay, so there are examples here. What are the examples, right? So most of you might think the moment you enter into first year, first I will do masti, right? Later on I'll start studying. So that is absolutely wrong, because first itself you have to study and later on you can do masti. Okay, so what is the wrong interpretation? Masti first, study later. This is a wrong interpretation which you should never ever follow. Okay. What does MA stands for? MA stands for a bone that is located in the middle ear. What is that? There are three ear ossicles, right? What are those three ear ossicles? Malleus, incus, and stapes. Okay, malleus, incus, and stapes. The joint that is located between malleus and incus is called as saddle joint. Okay, so this one over here is called as saddle joint. Very good, Najmul, very good. Saddle joint. Okay, second important thing. Second important thing is, see, these are carpals. What are the metacarpals? First metacarpal, second metacarpal, third, fourth, and fifth. So what I'm trying to tell you is, between the carpal and metacarpal joints, whatever are there, these are called as carpo-metacarpal joints. What are they? Carpo-metacarpal joints. So this is called first carpo-metacarpal joint, second carpo-metacarpal joint, third, fourth, and fifth carpo-metacarpal joint. So I'm talking about first carpo-metacarpal joint. So first carpo-metacarpal joint is a saddle joint. Okay. Second important thing is first carpo metacarpal joint or joint of your thumb is a saddle joint. Now coming to the third example. What is this third example? All of you know that this is your sternum. This is your sternum. And attached to the sternum, what is a bone do you have, guys? Anyone tell me what is this bone which is attached to the sternum? S-shaped bone. I don't know if I have. Yes. You see this S-shaped bone, right? So what is this S-shaped bone that is located attached to the sternum? It is attached like this, right? So the S-shaped bone which is attached in this way. What is this S-shaped bone called as? This is clavicle. So if there is a joint between sternum and clavicle, combine both the words, can I call it a sternoclavicular joint, right? So this joint is called as sternoclavicular joint. Okay, so what is the third important joint? Sternoclavicular joint is a type of what? Saddle joint. It is also a type of saddle joint. Okay, and the last example is, if you look in the foot, right? In the foot, a group of bones together they form an arch. That arch is called as a lateral longitudinal arch. When I will discuss lower limb, I will discuss in detail. Okay, now you won't understand because there are also ligaments that are present in that. It will be difficult for you. So, but just I'll draw a picture. Just look at that. Right. So if you see, you can see an arch like this, right? This arch is called as lateral longitudinal arch. Okay. So with the help of this lateral longitudinal arch, there is a joint that is formed that is called as saddle joint. Okay. So here we have got an arch called as lateral longitudinal arch. So we have discussed majority of the joints except ball and socket joint, which is very, very, very easy. I hope you understood all of that. Yes or no? You understood? Till here you understood before I move on to ball and socket joint? Guys, you are just listening or you're also writing something? You're also writing? Very good. Very good. Right. Now the last group we will discuss is ball and socket joint. Okay, we shall discuss ball and socket joint. Very good, guys. Very good. Very good. We'll discuss ball and socket joint. Now, how do you remember ball and socket joint? You can remember by a mnemonic called as SITA. 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 Okay. S stands for, most of you guys, I know you don't even need to have a mnemonic like this because you know very well what are the examples of ball and socket joint. So S stands for shoulder joint. Shoulder joint is a ball and socket joint. Right? So for those of you, why it is called ball and socket joint, I know you know it, why it is called ball and socket joint, but just for an example, I have the bones, so I have to show it to you. Ye dekho, you see here you have got a cavity, this is called as a glenoid cavity, right? And this part over here is called as the head of the humerus, right? So head is like a ball and this is like a socket. Ball is fitting into the socket and that is how you are able to move your upper limb. Okay, so this joint is called as ball and socket joint. This joint is called as ball and socket joint. Okay, second important joint is hip joint, right? So obviously hip joint also will be called as a ball and socket joint. Third important joint, now look, it is very interesting. Very good, very good, very good, very good. Ani Burugu malus incus stapes means malus incus stapes are the three bones that are located in the middle ear which are responsible for the transduction of the sound. Okay, from external ear to inner ear, if they have to someone to take the sound, that is because of these ossicles. Okay, so I told you malus incus as well as stapes. Okay, I told you malus incus as well as stapes. Now between malus and incus, I already told you the joint, right? What is the joint between malus and incus here? That is saddle joint. Now I'm telling you a joint between incus and stapes. Incus stapes, joint, two of them, insudostapedial joint. Okay, what is this joint? Insudostapedial joint. Insudostapedial joint. So this is also called a type of ball and socket joint. Now coming to the fourth joint, which is little bit complicated, guys. So just look here. If you understand the picture, you will understand it. Right. So here, all of you know that this heel bone, whatever is there, this is called as calcaneus. Just remember it. Even if you don't know, just listen to whatever I'm telling. Okay. No need to remember it. This is called as calcaneus. Above that, you have got this bone called as talus. T stands for talus. And here you have got another bone. This is called as navicular bone. Three bones: calcaneus, talus, as well as navicular bone. Three bones are there. Okay. Now, in between these three bones, you have got a joint. How do you spell this joint? Now you have to combine three words: talus, calcaneus, navicular. Talo, calcaneo, navicular joint. So that is also a type of ball and socket joint. Okay. So talo, calcaneo, navicular joint is also a type of ball and socket joint. Guys, so Najmul is asking what is glenoid cavity and what is acromion process. Najmul, in the scapula, this cavity is called as glenoid cavity. Okay, and you see this process over here coming from the back, right? This is called as acromion process, and this process you see, this is called as coracoid process. Okay, tomorrow when I'll be telling you the bones, I'll tell you in detail what are these. Okay, don't worry about that. Chalo. So guys, we are basically done with the discussion of all the types of joints. Now what I'm trying to tell you is that in the starting we have discussed about planar joints, right? So in the planar joints we have taken two examples, intercarpal and intertarsal. Now I wanted to add few more examples to it. Okay, few more examples to it. So let us discuss few more examples of planar joint. So actually, to discuss this planar joint, guys, you have to know a mnemonic. What is that mnemonic? John and Reeve, you can't understand whatever I've taught you. Guys, all of you are clear. Are you understanding? Is the problem same with everyone? You're not understanding? John Andrew, I want you to listen to the class from the starting onwards so that you'd understand the basics better. Very good. Now, coming to the plain synovial joints, what are the examples, guys? What is the best domestic airlines which you have seen, right? So, okay, everyone has their own best domestic airlines. Okay, so what I feel is Vistara is the best one. Okay, Vistara, I feel Vistara is the best one. Okay, okay, because they give food. Hello, every airlines will give food. Now, first thing in Vistara, the first letter stands for V. What does V stand for? V stand for vertebral joint. What vertebral joint? Costovertebral joint. Costovertebral joint. Now, what do you mean by costovertebral joint, guys? Costo matlab ribs. Yes or no? Costa ribs. Vertebra are the vertebra. So, between the ribs and the vertebra on the back, the ribs are attached to the vertebra on the back, you know it, rib cage, है ना? So between both of them, the joint, whatever you have is costovertebral joint, and that is your planar joint. Okay. Second example. Second example is I. What does I stand for? I already told you, intercarpal, intertarsal. Intercarpal, intertarsal joints. These are called as planar joints. Third important thing, S. Now here the real important thing comes, guys. When it comes to S, one very important thing I want to remind you. Just look at the picture which I'm drawing. All of you know this bone, right? And all of you also know this bone as well, right? Now, this bone which I'm drawing here, this is called as your tibia, and this bone is called as your fibula, right? So here if you see, right, so this is tibia and fibula. Guys, if you remember previously I told you that we have got a joint here between the tibia and fibula, right? And this is on the bottom. This is called as inferior tibiofibular joint. And inferior tibiofibular joint, yesterday I mentioned where did I mention it? In which example? Did I mention it in case of fibrous joints, cartilaginous joints, or synovial joints? Yes, tell me. Hello, Medmister. How are you? So where did I mention this? Come on, you should answer. I have mentioned in fibrous joints, right? In fibrous joints, I told you there are three different types of joints. One is called as, in fibrous joints I have mentioned, sutures, syndesmosis, gomphosis. In syndesmosis, very good. In syndesmosis, the example I have given is inferior tibiofibular joint. Now I am giving you another example, the same joint on the top. This is called superior, between tibia and fibula, tibiofibular joint, right? So this joint is superior tibiofibular joint. Okay, so one is your inferior tibiofibular joint, and the next one here is superior tibiofibular joint. So this is a planar joint, and that is a syndesmosis, fibrous joint. Okay, so keep these differences in mind. Now, fourth important thing, VIST. What does T stand for? T stands for thyroid joint. What thyroid? Cricothyroid. Now, to understand this, you have to know two bones. All of you know we have got thyroid cartilage here. Just below the thyroid cartilage, we have got cricoid bone. All of you know that, right? So let us say this is your thyroid cartilage. This is your thyroid cartilage. Just below the thyroid cartilage, you have got a bone. This is called as cricoid. This is called as cricoid, and this is called as thyroid cartilage, right? Now you tell me, what is a joint that is located between thyroid cartilage and cricoid? See, this is a joint that is located between thyroid and cricoid. So this is called as cricothyroid ligament. Okay, cricothyroid joint. So cricothyroid joint. So cricothyroid joint is a type of what? Planar joint. Cricothyroid joint is a type of planar joint. So this is a picture which you're seeing from the front. Okay, this is the picture which you're seeing from the front. The same picture, if you're looking from the back side, how does the picture look? All of you look here. If I'm turning the same picture back side, this is how it looks. This is your thyroid, right? And this is your cricoid, and on the back side you have got two extra cartilages. What are those two extra cartilages? So these are the extra cartilages. These cartilages are triangular shaped, and this is called as arytenoids. What are these called? Arytenoids. Okay, so if I'm drawing a joint in between the arytenoids and the cricoid like this, arytenoids and cricoid, what you should call it as cricoarytenoid joint. What is the fifth type of joint? Cricoarytenoid joint. Okay, cricoarytenoid joint. So these are the 5 important types of planar joints. What are the 5 important types? Costovertebral joint, intercarpal intertarsal joints, superior tibiofibular joint, whereas inferior tibiofibular was fibrous joint, cricothyroid, and another one is cricoarytenoid. So these are the different types of joints which we have discussed, guys. So all of you understood whatever I have discussed right now regarding the joints. Everyone understood each and every part without any doubt. All of you are clear with your concepts? Yeah, let me know so that I'll continue with the next topic. Completely clear, right, everyone? Lipika, you are clear. Varun Kashyap, right? Varun Kashyap, Kiran Yadav, Suraj, Ricky, Mehnaz, Fun Mode, Srishti, Najmul, all of you are clear? Yeah, Ricky, in the app there is much more clear explanation. Sure, it will be shared. Don't worry about that. Right. So now what we shall do is that we shall discuss about the fertilization. Okay. Yeah, this is more than enough for Sanyasi. Most of the MCQs will be covered. Okay, don't worry about that. Okay, because I have even covered the clinical part also, so that must be more than enough. Right. So now coming to the oogenesis. So before we discuss oogenesis, okay, before we discuss oogenesis, now all of you pay attention. This part is little bit adding to the physiology also. You have to understand with utmost clarity. Okay. Little bit about oogenesis. Before starting that topic, I wanted to start from day 0. Okay, I wanted to start from day 0. So last class, Najmul, today also have talked about the last class. So together in combined we will send. Okay, chalo, concentrate now. Stop commenting. Let us start from day 0. Day 0, the day fertilization has taken place. Okay, so today fertilization has taken place. Okay, from today till the coming 2 weeks, till the coming next 2 weeks, you call this period as germinal period. What do you call this period as? Germinal period. You call this period as germinal period. Now from the two weeks के बाद क्या होगा? Third week, right? So from 3 weeks all the way till 8 weeks, 3 weeks all the way till 8 weeks, you call this period as embryonic period. What do you call this as? You call this period as embryonic period. Okay, now after 8 weeks क्या होगा? 9 weeks, right? So from 9 weeks till birth, from 9 weeks till birth, you call this period as fetal period or fetus. You call this as a fetal period or fetus, right? So what is fetus? First of all, you have to ask a woman which month are you right now, which week of gestation are you right now in, right? If she will tell I'm in 10th week of gestation, so right now the baby which is inside you is called as a fetus. Till the birth you have to call that as a fetus. Before that you should call it as an embryonic. Usse pehle దానికన్నా ముందు you have to call it as a germinal period, right? So all of you understood these three parts, because these three parts will also repeat in your pediatrics also. Okay, so pediatrics point is covered right now here itself. It will also repeat in pediatrics. So remember these values only, don't remember any other values. These are the standard values. Okay, now after this, what will happen? What is oogenesis? Right, so oogenesis is nothing but the formation of the oocyte, formation of the ova, right? So in this process of what is spermatogenesis? Formation of sperms, right? Now first we'll discuss oogenesis because it is a little bit complicated. So during the embryonic period, if you look at the embryo, the developing embryo, how does the picture of a developing embryo look? This is how it looks. This is how the picture of a developing embryo looks. Now in this developing embryo, see, this is called as a head fold and this is called as a tail fold. Okay, so the head fold in future will develop into the head, the tail fold in the future it will develop into the anus. Okay, and second important thing is that here you have got foregut, right? Foregut, and just look at the picture whatever I'm drawing. Right, so there are three guts, all of you know this, right? So this one is called as foregut and this is called as midgut and this is called as hindgut. Hindgut will develop into the anus, foregut will develop into the mouth, all of you know. So this is the developing embryo. Now to this developing embryo you need continuous food supply. From where the food is coming? It is coming from the yolk sac. So let us say that this part over here is called as your yolk sac. So this is called as your yolk sac. Okay, now in the developing embryo there are also some things like this. These are called as gonads. Let us say this developing embryo whatever is there, right? So this is gonna be a baby girl in the future. Okay, so in the baby girl, do you have testes or ovaries? You will have ovaries. What are the gonads do you have? You will have ovaries, right? So these ovaries which are not yet developed, or these gonads which are not yet developed, these are called as genital ridges. Genital ridges matlab those gonads which are not yet fully formed, not yet developed. Okay, so right now I have to call this as genital ridge. Genital ridge, but for you to understand I will just write it as ovary. Ovaries. Okay, now from where the oogenesis will start? Oogenesis will start with a group of cells called as primordial germ cells. Okay, with a group of cells called primordial germ cells. Primordial germ cells. Where are these primordial germ cells? These primordial germ cells are located in the wall of the yolk sac. Okay, so these are a group of primordial germ cells that are located on the wall of yolk sac. Now what will happen? What will happen is that during the 4th week of embryonic development, again remember, during the 4th week of embryonic development, these cells whatever are there, very good fun mode, these are also called PGC, very good. PGC. During the 4th week of embryonic development, what will happen is that these primordial germ cells, they are traveling, right? So slowly they are migrating, migrating, and finally what is happening? These primordial germ cells are entering into your genital ridge or the ovaries. Okay, sir, when the primordial germ cells will reach the ovaries? By the end of the 4th week. So within the ovary, whatever process is happening, whatever story is happening within the ovary, that story is called as oogenesis. So before I discuss oogenesis, two important points I want to tell you. Now look how am I applying the clinical anatomy. Two important points I want to tell you. Agar, for example, if these primordial germ cells, by mistake, if they travel to the head and neck, if they travel to the head and neck, what will happen? Within the head and neck, these primordial germ cells say divide and form different kinds of tissue. right? They form hair, they form teeth, right? They form muscles, they form bones. So many things are formed in the head and neck. So that combination of hair, nails, skin, right, teeth, bones, right? So all these things, whatever are formed, this is called as teratoma. What are they called? This is called as teratoma. And where is this teratoma formed? This teratoma is formed in the cranial region and the pharyngeal region. Okay, so this is the pharynx here, right? This is the pharynx. So exactly here on the back, these cells have migrated. So exactly here on the back, you will see a cancer formation. Simple words to tell, a cancer, a teratoma formation. That is called as craniopharyngeal teratoma. So if you look at in this picture itself, here itself, there is an abnormal growth like this. Okay, and this abnormal growth is covered by a sheath. Okay, and this is called as craniopharyngeal teratoma. Why is this formed? Because of abnormal migration of primordial germ cells to the head and neck. Just look at the picture. See, all of you look at the picture. This is called as, what is this called as? Craniopharyngeal teratoma. Craniopharyngeal teratoma. You know what will happen when you dissect this teratoma? In this, you know what will you find? You will find teeth, right? You will find hair. You will find hair. You will find nails also. Not only nails, you will also find bone tissue. You will also find muscle tissue. Everything is located within this teratoma. Okay, right. Now, what is the second pathology? Instead of going up, if these they go down like this, instead of going up, if these primordial germ cells are going down, down matlab kahan? Piche, where the sacral region, coccyx, sacral region, right? So if they go there, don't you think there will also be a protrusion in the bottom like this, right? So can I call this part as sacrococcygeal teratoma? So this part over here is called as sacrococcygeal teratoma. Sacrococcygeal teratoma. Just look at the sacrococcygeal teratoma. You see this? You see this picture over here? Very clear picture, right? So this is a picture of sacrococcygeal teratoma, which is formed in the sacral and the coccygeal region because of the primordial germ cells migrating to the sacral and the coccygeal region. Till here, you are clear with the clinical part? Yes or no, guys? ये देखो ये भी. You're clear with this? So from now onwards, by chance, if there is a chance for you to visit to the hospital and you see such thing, will you be afraid or will you go and tell their attenders of the parents, telling that this is what has exactly happened? Yes or no? You will understand all these things, right? Very good. Very good. Treatment is nothing, resection. You just have to resect this tumor. That is the only thing. Okay. So now let me draw ovary. Let us discuss the story which is inside the ovary. Let us say this is ovary. I cannot draw the full ovary. Just think this is an ovary. Okay. Now, yeah, baby will survive. That is not a problem, but he will survive with a defect. Okay. So this is an ovary. Now, in this ovary, what are the cells that entered? Primordial germ cells, right? So this is a primordial germ cell which has entered. Primordial germ cells. Primordial germ cells. Okay. If you look now, the important thing comes. Important thing is what is the number of chromosomes and what is the amount of genetic material that is located inside. If you look at the chromosomes, see, these are the chromosomes like this. How many chromosomes are there? 2 chromosomes. Guys, one thing I want to make you clear in this is that just look here. Now I'm drawing a chromosome. How many chromosomes are here? Tell me. This is only one chromosome. This is only one chromosome. Now tell me this thing from your +1 +2 knowledge. Now tell me how many chromosomes are here? Yeah, be fast. Very good. This is also one chromosome. How will you tell is that? Simple thing. Look at the center point. Okay, most of you know this anyways. For those who don't know, this center point is called as centromere. Okay, center point is called as centromere. Number of centromeres is equal to number of chromosomes. अभी यहाँ पे कितने centromeres है? Only one. So this is called as one chromosome, but it is called as double structured chromosome. Okay, so this is also called as a chromosome. Now this entire thing here is called as a chromatid. This is called as chromatid. Okay, but if you look at this point, this one, double structured chromosome, how many chromatids are there? See, this entirely is one chromatid and this entirely is two chromatids. So there are two chromatids but at a single chromosome. Clear, all of you? So I hope you understood this basic thing. Right, now let us get back. So here how many chromosomes are there? I have got two centromeres, so two chromosomes are there. So I will write it as 2CHR. Okay, two chromosomes matlab guys, two pairs of chromosomes. Two pairs of chromosomes matlab how many chromosomes? 46. There are 46, right? Now next important, 46 matlab two pairs of chromosomes matlab 23 pairs, 23 pairs. Sorry, 23, 23. Okay, 23, 23, that is 46. Okay. Now, if you look at the genetic material inside, just look at the genetic material inside. There is the amount of DNA is one copy of DNA genetic material in one chromosome and another copy of genetic material in another chromosome. So genetic material is also 2 only, right? So I will write it as 2N. N stands for genetic material. Okay, so 2N, capital N. Clear? So now if someone asks you what is the ploidy, what will you tell? Haploid or diploid? This is diploid. Okay, with the 2N genetic material. Now, this primordial germ cells, what will happen is that these primordial germ cells, by a process called mitosis, guys, don't write anything, just listen to whatever I'm telling. These primordial germ cells, by a process called mitosis, they keep on dividing. So they keep on dividing like this. Okay, so whatever divisions, whatever it has done, this is called as oogonia. What are these called? Oogonia. Sir, what is the genetic makeup of oogonia? The same thing. Genetic makeup is two chromosomes and each one two chromosomes and 2N genetic material. The same thing. Okay. Now, if you look carefully, guys, this is the wall of the ovary. From the wall of the ovary, the epithelium comes down. Ye dekho. From the wall of the ovary, the epithelium is coming down. And this epithelium, what is happening? This epithelium is in between these oogonia. What is this epithelium? This is the epithelium that is coming from the wall of the ovary. Now, overall, if you see, there are eggs. Eggs are buried in a nest. Yes or no? Eggs are buried in a nest. So, this is also called as another term that is called as germ cell nest. Germ cell nest. Okay. So, this epithelium is called as ovarian epithelium. Ovarian epithelium, which are usually flat. Ovarian epithelium, which are usually flat. अभी बन्नी अभी syndesmosis कहाँ से आया? Fibrous syndesmosis. We are done with this, Bunny. Now, what is going to happen? What is going to happen is that these oogonia, out of all oogonia, one oogonia will become large, and baki sab oogonia, what will happen? They will shrink away. Okay, so one oogonia is becoming large, and that is what is called as your primary oocyte. Okay, so this is called as primary oocyte. And what about this red color epithelium? This red color epithelium starts lining this primary oocyte. Red color epithelium starts lining this primary oocyte. Okay, sir, अब बताओ यहाँ पे what is the genetic material? Same thing. One chromosome, another chromosome. So diploid. Genetic material, one set of genetic material, another set of genetic material. So 2N, the same thing, right? Now, whatever is going to happen is very important. Just listen carefully now. Now, what stage do we have here? We have got primary oocyte. Where is this all happening? This is happening in the ovary. Ovary of what? Ovary of the developing baby. Ovary of the baby girl which is in the mother's womb still. It has not given birth to that baby girl still. Okay, it is in the mother's womb. Now, once primary oocyte is formed, this primary oocyte will enter into a stage called as meiosis 1. Meiosis 1. Okay, in meiosis, what are the stages, guys? We have got prophase. Okay, let me write it down. In meiosis 1, we have got stages like prophase. We have got metaphase. We have got anaphase. anaphase, and we have got telophase. We have got telophase, prophase, metaphase, anaphase, telophase. Okay, prophase 1, metaphase 1, anaphase 1, telophase 1. Now what will happen? Within the prophase also, there are 5 different stages. What are these 5 different stages? One is called leptotin stage, leptotin stage. Another one is called as zygotin stage. Okay. Another one is called as packaging stage. Next one is called as diplotin stage, and last one is called as diakinesis stage. Okay, so here D stands for diplotin, diplotin stage. So this is diplotin stage. D stands for diplotin stage. Okay, should I remember all these things are not needed? Okay, just for your understanding purpose, I'm telling. Whatever you have to remember, I will tell you at the end of the session. Now, this primary oocyte, listen carefully, this primary oocyte is entering into meiosis 1, right? First, it will enter into leptotin stage of prophase 1. Some development will happen. Now it will go to zygotin stage. यहाँ पे कुछ और development होगा. Now it is going to packaging stage. Here also there is some more development. Now it is entering into diplotin stage. After finishing the diplotin stage, the primary oocyte whatever is there, it will not go to diakinesis. क्योंकि diplotin stage itself, the primary oocyte will be arrested. It will not divide further. यहीं पे arrest हो जाएगा. Okay. So what is happening? The arrest is happening in the diplotin stage. So in the diplotin stage, कहां तक इसका development हुआ? We will see. How much it has been developed, all these stages, we'll see now. In the diplotin stage, the primary oocyte is like this. Now look here. This is a primary oocyte, right? So ये देखो, this nucleus in the center is a primary oocyte, and surrounding that you have got a flat layer of epithelial cells. Now these flat layer of epithelial cells are derived from where? These are derived from the ovary, right? Now these cells are now called as early granulosa cells. Early granulosa cells. Okay, sir, what about the genetic material? If you want to look about the genetic material, this is how it looks. Previously, this was the genetic material of primary oocyte. Now what has happened? By crossing all these stages, this chromatid whatever is there, right, now it divided like this. It divided into a double structured chromosome. ये देखो, एक additional structure आ गया यहाँ पे भी there is one additional structure. Okay, and within this the genetic material also doubled. Previously ये देखो, each chromosome is having one set of genetic material here, right? Now what is happening is that each chromosome is having two sets of genetic material. Okay, by looking at the centromere cell, how many chromosomes? The same 2 chromosomes. So 2CHR matlab 46 chromosomes. But come discuss about the genetic material. How many genetic materials are there? 4 copies of genetic material. So I have to write as 4n. Pehle, how many copies of genetic material? 2n copies. Here also 2n copies. But now here 4n copies. Now this epithelium which I have drawn here, right? So this epithelium is called as early granulosa cells. So what do you call this entire stage? This entire stage, whatever I've just now told in front of you, this is called as primordial follicle. Primordial follicle. So you might get a doubt, sir. Primary oocyte has undergone all these stages and arrested in diakinesis stage to form this primordial follicle? Yes. Clear? Now what will happen? Baby's birth will happen, right? Finally a baby girl. Now once the baby girl is born, from the day, today the baby girl is born. Today whatever story is happening within the ovaries till the onset of her puberty. By the time she achieves 13-14 years of age and still attain puberty, till then whatever story is happening within her ovaries, I will discuss now. तो मतलब ये जो स्टोरी मैंने डिस्कस किया, all this is before the birth. Before the birth मतलब can I write it as prenatal? Prenatal, right? Now story whatever I'm discussing is after the birth, so I'm calling it as postnatal. Postnatal. So what will happen with this primordial follicle? This primordial follicle will enter into a next stage. What is that next stage? All of you look now. See, in the center we have got now primary oocyte, right? Now let us say This is a primary oocyte. And what did I tell you? Surrounding the primary oocyte, there were flat layer of epithelial cells called early granulosa cells. अब देखो क्या होगा? These flat layer of epithelial cells have become which shape? They have become cuboidal shape. What are the flat layer of epithelial cells become cuboidal shape? Those were called early granulosa cells, and now I'm calling them as a granulosa cells. You see the transformation? Granulosa cells. What is the shape of this? Flat or cuboidal? Cuboidal. Cuboidal. Okay. Now, exactly at this stage, what is going to happen? Now, listen very carefully. Exactly at this stage, this primary oocyte will start releasing a small glycoprotein molecule. Okay. So, it start releasing what? A glycoprotein layer. And this glycoprotein layer, see, it start releasing a glycoprotein layer. And this glycoprotein layer is completely surrounding the primary oocyte like this, right? This glycoprotein layer is called as zona pellucida. Okay, this glycoprotein layer is called as zona pellucida. What is this? This is a glycoprotein layer that is released by the primary oocyte. Okay, so till here whatever development I have just shown you, this is called as primary follicle. What is this follicle called as? Primary follicle. So first it was primary oocyte. From primary oocyte, the next stage is primordial follicle. From primordial follicle, now primary follicle. After primary follicle, look at the next stage, what is happening. In the next stage, this is a primary oocyte. Surrounding the primary oocyte, I have got this layer. What is this? Zona pellucida, right? And okay, right. So I have got this layer called as zona pellucida, and after that, these are the cuboidal cells. Now look, a magic happens here. What is that magic? The magic is that in the late primary follicle stage, right now, FSH is released. What is FSH, guys? FSH stands for follicle stimulating hormone. From where it is released? From your pituitary gland, right? So from your anterior pituitary gland, follicle stimulating hormone is released. At which stage? In the late primary follicle stage. What this follicle stimulating hormone will do is that it will cause further growth of these follicles. Further growth matlab ye dekho, these are the cuboidal cells. It will cause proliferation of the cuboidal cells. So this FSH will cause proliferation. You see, cuboidal cells are dividing like this. Multi-layered cuboidal cells are formed, right? So is this the only development does FSH do? No. FSH also allows for the formation of a special group of cells here. See, these special group of cells which are forming right now, these are called as theca cells. What are these called? Theca cells. Theca cells. So what are the things here that are present right now? These cells are called as theca cells. Okay, and these are proliferation or multi-layered cuboidal cells. Multi-layered cuboidal cells. Why it is happening? Because of the effect of FSH. Okay, this stage, whatever you can see right now, right, this stage right now is called as pre-antral follicle. Pre-antral follicle. Okay, or you can also call it as a secondary follicle. Secondary follicle. Pre-antral or secondary. Primary oocyte, primordial follicle, primary follicle, secondary follicle, or pre-antral follicle. Sir, why it is called pre-antral? I'll tell you in the next step. Now, in the next step, okay, before I show you the next step, just you imagine what might have happened in the next step. In the next step, furthermore, proliferation might have been taken place. Furthermore, the cuboidal cells have been increased in layers. Furthermore, the theca cells have been increased in layers. Yes or no? Now, the same thing is happening. Look at the next layer. In the next step, the cuboidal cells layers are increasing because of FSH. The theca also, the thecal cells also, they also start increasing like this. You see, how many layers of theca are formed right now? 2 layers of theca are being formed. You see, 2 layers of theca are getting formed. All this is happening because of what? Follicle stimulating hormone. Okay, so this theca, this is called as theca, right? How many layers? Two layers. So this is called as outer theca, okay, and this one is called as inner theca. Outer theca and inner theca. Okay, so outer theca and inner theca together, you call it as, what do you call it as? Theca folliculi. You call it as theca folliculi. Okay, guys, if you closely look surrounding the primary oocyte, there are some cuboidal cells which are very dark. If you see here, yes or no, there are some cuboidal cells which are very dark that are surrounding these primary oocyte. These dark cuboidal cells which are attached here, these are called as cumulus oophorus. What is this called? Cumulus. You see, this one is called as cumulus oophorus. Okay, now what do you call this stage as? This stage is called as antral follicle, क्योंकि पहला pre-antral follicle, so this is called as antral follicle. Antral follicle. So what is this antra? Antra matlab cavity. If you see here clearly, slowly a cavity is formed here. You see here, there is a cavity that is formed here, where in between the cuboidal cells. So this cavity, whatever is formed here, this is called as antrum. This is called as antrum or antral cavity. That is why you call this phase as antral follicle. इससे पहले जो भी होगा, that is called pre-antral. I hope you are clear right now. Till here you are clear, guys. We are almost next 5 minutes we are done with this topic. You are clear till here, everyone? Clear? Very good. So this is called as antral follicle. Now at this antral follicle stage, selection happens. What do you mean by selection? Selection matlab there are some hundreds and hundreds, thousands and thousands of antral follicles. Out of all these, only one antral follicle is selected. Okay, that selected antral follicle will enter into the next step. Okay, that selected one will enter into the next step here. Okay, so this follicle which you can see here is an antral follicle. Antral follicle. So this antral follicle will undergo selection, and because of this selection it will enter into the next step. Sir, selection किस basis पे होगा? On which basis selection will happen? Selection will happen based upon three things. Actually, there is one article, right, in a very famous website called as ResearchGate. Okay, so in that they have given that there is no clear mechanism till date on what basis the selection happens, but they believe that selection happens on three important things. One is based upon the size. Agar size chota hai, it is not selected. If size is well enough, that is selected. Second thing, if this follicle is releasing, right, if this follicle is releasing estrogen, it is selected. If it is not releasing estrogen, that is not selected. Third thing, if this follicle is listening to FSH, listening to FSH matlab, if it is sensitive to FSH, with the help of FSH, is it growing or not? If it is not growing, it means it is not listening to FSH. So those are not selected. Okay, so based upon three things, one is it decides based upon the size, it decides based upon the sensitivity to FSH, and third thing, it also decides based upon the estrogen. So based upon all these three important things, you select the antral follicles. Out of all these antral follicles, one antral follicle is selected. Okay, this selected antral follicle will become what? Graafian follicle. What will this become? Graafian follicle. Graafian follicle. Sir, what is the labeling here? Koi labeling nahi hai, the same labeling which you already know. So this will become a Graafian follicle. Okay. Once Graafian follicle is formed, Graafian follicle is also called as a fully matured follicle. Okay. Once this Graafian follicle is formed, you remember in the starting that primary oocyte, ये देखो center में जो primary oocyte थे starting में, primary oocyte performed meiosis 1. In meiosis 1 it undergone what stages? Leptotin, right? Zygotin, pachytin, and diplotin, it stopped in the diplotin stage, right? Now once graphene follicle is formed, from diplotin stage, the next stages will start. After diplotin, what do we have? Diakinesis. Now diakinesis is formed. Why? Because the primary oocyte is now released from the jail. Now diakinesis will happen, right? After diakinesis, prophase is finished. The next phase is metaphase, right? After metaphase, we have got anaphase. After anaphase, what do we have got? We have got telophase. We have got telophase. Now, successfully, the Graafian follicle or the primary oocyte has completed all the stages. All the stages of meiosis 1 are completed by this Graafian follicle. Okay? So, till here you understood, guys. This part is a little bit tricky. All of you understood till here? Yeah? Very good. So once this entire thing is meiosis 1, after meiosis 1 completion, now it has entered into meiosis 2, right? But what is the result of meiosis 1? Meiosis 1 complete hone ke baad, this primary oocyte divides into two cells. What are these two cells? One nucleus is larger, one nucleus is very smaller. This larger nucleus is called secondary oocyte, and this small body is called as primary polar body. Primary polar body. Okay, if you want me to show here, I'll show it here. All of you look carefully now. So you see here, this is called as secondary oocyte. Okay, and this small body which you can see is a primary body, primary polar body. Okay, so this is your secondary oocyte. Secondary oocyte. Clear now? All of you understood? Secondary oocyte. Now what will happen? This secondary oocyte, what will happen is that now at this stage, can I tell meiosis 1 is finished? Right? Now this secondary oocyte will enter into meiosis 2. Meiosis 2 may be same stages. Prophase 2, metaphase 2, anaphase 2, telophase 2. So this secondary oocyte will enter into prophase 2. It will finish prophase 2. It will enter into metaphase 2. It will not finish metaphase 2. फिर से ये arrest हो जाएगा. Again it will be arrested. In metaphase 2, again it is arrested. All of you understood where the primary oocyte will be arrested? Diplotin stage of prophase 1. Where the secondary oocyte will be arrested? Metaphase 2. Okay. Now listen with both of your ears what is happening here. Okay. So before I show you this, let us look at all the stages which have kept it in an ovary. The same stages, kuch difference nahi hai. Okay. See, this is called as primordial germ cell. It divided into what are these? These are called as oogonia. Out of all oogonia, one oogonia is matured. That is called as primary oocyte. Primary oocyte will be converted to primordial follicle. Primordial follicle will be converted to primary follicle. Primary follicle. Primary follicle will be converted to preantral follicle or secondary follicle. Secondary follicle will be converted to antral follicle. Why? Because there is a cavity here. This antral follicle is converted to finally, what is this? It is converted to Graafian follicle. Sir, what is this extra one? Ek extra draw kiya maine. Okay, just leave it now. So it is formed, a Graafian follicle is formed. Now, once this Graafian follicle is formed, right now at this stage, what is gonna happen? Just think, one very interesting thing will happen here. Now, right now at this particular stage, I told you that at the primary follicle stage onwards, FSH release hona start hua, hai ki nahi? FSH started releasing from this stage only, right? So, exactly at which stage? See, from this stage, FSH started releasing, it caused growth. Again, here it has got much more growth, right? Little bit more growth here, and here also little bit more growth. Now, finally, what this FSH will do is that, ye dekho, this FSH, listen very carefully now. This FSH will start activating, what it starts activating? It starts activating your theca cells. Once theca cells are stimulated by FSH again and again and again, this theca cells start releasing an enzyme called as aromatase. it starts releasing an enzyme called as aromatase. Okay, what this aromatase will do? What this aromatase will do? Within the blood, don't you think you have got estradiol? Yes or no? You have got estradiol. This aromatase will convert. What I'll do is, I'll put this part, compress this part for a meanwhile. Okay. Now, what will happen is that this aromatase will convert estradiol, okay, into estrogen. Estradiol into estrogen, right? What will happen when there is excess estrogen? If more FSH is stimulated, then the thecal cells are activated more. If they are more activated, then excess amount of aromatase is released. The more the aromatase, the more the level of estrogen, right? Now look what will happen. This is your pituitary gland. This is your posterior pituitary. This is your anterior pituitary. All of you know, from your anterior pituitary, FSH is released and luteinizing hormone is released, right? So they are acting on what? They are acting on ovary. They are acting on ovary, right? Now from the ovary, what is released? Estrogen is released. Estrogen is released. For example, if there is excess amount of estrogen, what will happen? This estrogen will go back and inhibit the anterior pituitary. When it will inhibit the anterior pituitary, FSH LH level will fall down. So this kind of mechanism is called as negative feedback mechanism. Okay, so actually it was given in that research paper that excess mild to moderate levels of estrogen will cause negative feedback inhibition, thereby reducing the level of FSH and LH. But अगर estrogen levels बहुत ज़्यादा हो गया, if they are more and more increased, that will promote the growth of, that will promote the release of luteinizing hormone more. Okay, so this was a confusing point which I felt. Okay, so if there is excess amount of estrogen, instead of negative feedback, there is positive feedback, and the luteinizing hormone levels are increased. Okay, so right now at this Graafian follicle stage, which hormone levels are in peak? Luteinizing hormone levels are in peak. Now this luteinizing hormone, what does it do? This will cause complete maturation of Graafian follicle, and finally this part, what is this? The secondary oocyte is released out, and that release of secondary oocyte outside is called as ovulation. Okay, all of you know this, that all of you know this part, that we have got our fallopian tube like this. This is your fallopian tube. All of you know we have got the ovary over here. So here the secondary oocyte, now it is released into the fallopian tube. Okay, so this is called as your ovulation. Clear? If someone asks you ovulation is happening because of which hormone, that is luteinizing hormone. Luteinizing hormone. Okay, fine. Ovulation has happened. Ovulation होने के बाद what is going to happen next? What will happen is that, you see, this is the material which has been ovulated. Okay, this is the material which has been ovulated. Now once this ovulation has happened, now there is no secondary oocyte. This is empty completely. This box is completely empty. Now what will happen here? What will happen here? This leftover part, this leftover part is what is called as your corpus luteum. Corpus luteum. This corpus luteum will wait for 14 days. Okay, 14 days के लिए wait करेगा. उसके बाद what will happen is that this corpus luteum will slowly shrink, and finally it will convert into corpus albicans. So finally it will convert into, it will shrink, and finally it will convert into corpus albicans, which is also called as white scar. White scar. Right? So this is the entire story which I wanted to explain regarding the oogenesis, guys. Okay, so all of you see, this is just an introduction. I don't want to go in much more detail, है ना? तो किस stage पे कौन सा hormonal level बढ़ेगा, right? Which hormonal level is decreased? So all those things, it would take a longer time for you to, for me to discuss to you, and that would be discussed in subsequently in the MBBS lectures when I meet you lively. Okay, okay. So right now, all of you understood whatever topics I have discussed right now today? Everyone perfectly clear? Without any doubt, all of you understood, guys? Ricky, you are right. The leftover part will release the corpus luteum part. It would release progesterone that is useful for the maintaining of pregnancy and also that is a different thing. We shall discuss it later on. All of you understood, guys? Very good. So if the same lecture, if without drawing pictures, if would have posted it directly with the help of slides, will you understand it? No. So that is what I'm telling you. Right, the day one of your MBBS onwards, try drawing the pictures and learning. Because when you draw the pictures and you're learning, it indirectly you are saving a lots and lots of memory. Because there are some more subjects which really require a lot of memory. Okay, so you can minimize this part. So that is why I'm telling you it will be interesting and it will also be easy for you. Let it take time, right? It is all one time effort. Getting it? Right. So this is all you need to know regarding the oogenesis part. Okay, the gametogenesis part. So thank you so much for watching this video, guys. Thank you so much. Goodbye and see you tomorrow.